Hey, welcome. This is Here's to Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center here in Rocky Mount. This is a community-sponsored program by WHIG. This is for you, about you, and by you. We want to promote good health in you. We want to promote good health in our community, and we want everybody to be the best that they can be. And so I thank you that you're watching tonight. We are live tonight, so if you have any questions or any observations, give us a call, 407-1111. So tonight we're going to talk about several things. I'm going to talk about organic eating for a minute. And then we're going to talk about tick bites, spider bites, snake bites. You know, that's this time of the year, this season, we have all these insects out there that just love to bite us. And so we're going to talk about that. And we'll talk about moving and energy too if I get to it. We'll see. Oh yes, and we're going to talk about heat exhaustion and heat stroke. What's the difference? How do you know if you had it? How do you treat yourself? So, why does eating organic matter? So, you know, non-organic apple is $1.19 a pound. An organic apple is $2.41 a pound. That's a big difference. And some people just do not have that money. But non-organic, 80% are treated with diphenhydramine, was banned in the what is the EU, European Union, as a potential carcinogen. You know, our food industry, they let stuff slide by. They get paid by, what's the word? What is it when people come and they lobby? They lobby. The lobbyists say, well, you know, we'll give you this amount of money. Just put it in like this. So they'll word it so it doesn't sound so bad. But organic, you can have no more than 5% of pesticides in conventional produce. So 80% possible carcinogenic versus 5%. That's where you're paying the money. It costs a lot more to produce organic food because you've got to, you know, it's a lot easier just to spray the field. Just to spray it all and the bugs are gone, the weeds are gone, everything's gone. But the carcinogen is still there and we ingest it. I personally think that part of the reason that we have so much cancer in this community as well as in the whole United States is because of the food and how it's processed. And you know, anybody who's watched me knows I've harped on this for, I guess I've been here 6-7 years now. And I've harped on this since then that, you know, I mean, we have our own eggs. We just bought into 1/4 of a steer, so I have pasture-fed beef in my freezer. I've got a deal with somebody who grows pigs, so I can get some pork. And then, of course, my husband and my son love to hunt, so I'm hoping that they'll get a deer this year, but they haven't been very successful. They don't go out enough. They don't belong to a hunting club. And that's really what you want to do if you want to make sure you get a deer. So we'll see about that. But anyway, so why do we eat? Why does organic eating matter? And that's just the tip of the iceberg with the carcinogenic treatments that they have. And of course, you know, our farmers market is thriving. It is great. They have wonderful vendors and they have wonderful foods and produce from all over locally. I love to go because it's like old home week, man. You go and see people you haven't seen since probably last year at the farmers market. So, you know, it's impossible to eat 100% organic. It's impossible to grow 100% organic. And you know, if you are eating some cantaloupe that came from Chile, well, you know, it was picked green and it was preserved with something like, I know they spray some sort of a gas on bananas to preserve them for the trip from Hawaii to Rocky Mount, North Carolina. So, you know, I try to eat my fruits and vegetables in season, because then you're going to get the local. You're not going to get stuff from Chile and Mexico and even California. You know, it's still not organic in this country, but our laws are so lax, excuse me, that I'd rather buy some frozen apples than buy apple in July in North Carolina, because they're not, this isn't their season, so who knows where they've been, how long ago they were picked. But that's me. So, you know, there's no scientific evidence at this point that eating organic is better for you. There is a lot of people studying it, and they're looking into it. But, you know, even the carcinogens that you're exposed to, there's no proof positive at this point that it really is bad for you. I don't think it takes a rocket scientist to figure out, oh, it can cause cancer. Oh, should I put it in my body? No. And I think if you know, if any fruit that you can peel, like you could peel the apple and then you wouldn't have as much of the possibility of the carcinogen. However, the apple peels is what's good for us too, so that's a catch-22. So, you know, I try to eat local. I try to grow a lot of my own food. I'll be canning a lot. That's going to start in another few weeks, and then every night after work I'll have something put in a jar. But that's because I think it's important, and that's because I think it's more healthy for me and my family. So I just think that, you know, if you can eat organic, do it. If you can't, I understand it's much more expensive. I get that, and so, you know, I don't, if you can't, you can't, because people are on limited budgets too, and in this crazy world we live in, who knows if you're going to have a job tomorrow. So we'll move into the tick bites. It's that time of year. I've seen several already. I did have somebody test positive for Lyme's disease, but it was not an active infection. She had had the Lyme disease before, and once you've been positive, you stay positive, but the numbers are different. So, you know, most tick bites are painless. That's part of the problem, because we don't even know they're there. Or you might start to itch a little bit and you feel this thing on your skin. But most tick bites are painless and only cause minor irritation, redness, swelling, a little sore on the skin. Some ticks transmit illness. You know, they have bacteria and they cause illnesses. Lyme disease is the big one, and Rocky Mountain spotted fever is the other one. In general, to transmit Lyme disease, a tick needs to be attached for at least 36 hours. And that really, you think, well, 3 days, good grief, but you know what? No, it's not 3 days, it's a day and a half. But I'm sure every one of you that's out there has had a tick on you, and you pull it off and you say, I have no idea when I got it on me. And if you'd been outside all afternoon, you don't know. There is a tick, and for the life of me, I can't remember the name of it, but it causes an alpha-gall reaction, which means that you become allergic to meat. You cannot eat any food that is on a hoof. Deer, cow, pig, lamb, goat, you can't eat those things because you'll have an allergic reaction. It can cause anaphylactic shock, and it can send you to the hospital. It could even put you on a ventilator. So you've got to be careful of that. And I'll tell you the story of my goddaughter. She did not know that she had been bit by a tick. She did not know that she had an allergy. And she had, I think her and her husband, they eat a lot of Mexican food. and I think they had stopped to get some, no, she had pork in a crock pot at home. And she ate some. She's not a big eater, she's a picky eater. She picks a little bit and eats and that kind of thing, but she did eat some pork. And then about 2 o'clock in the morning, excuse me, I do this every time I come on TV. I think it must be the lights or something, I don't know. About 2 o'clock in the morning, she couldn't breathe, and so she woke her husband up. Here she was in nothing but a t-shirt and panties. You know, us ladies don't wear pretty clothes, and she couldn't breathe. So Gary, her husband, had to call 911, and they got her in the ER and gave her some Benadryl and some medicines, and she came out of it and did not have to be intubated. But you know, they said, you know, you need to follow up with an allergist, because she had no idea what happened. She, you know, she told them what she'd eaten and that kind of thing. So she didn't think too much of it, and she just kind of went on her merry way. And about a week later, she had the same incident, and they had to call 911 again. And again, she was about that far from being intubated. And so her husband put his foot down and said, "You are going to call the allergist." So she went to the allergist, and he did some testing, and he's the one that found out that she had the I have to look it up. I can't remember but it's a specific tick, and it might be a deer tick. I don't think it's a deer tick. But she had that, and the allergist said, do not eat any more meat on a hoof. So she can have fish, she can have chicken, turkey, but nothing else. And so she's learned how to carry a allergy pen, so she keeps that all the time with her. But hang on. So she went on and did her thing and had the EpiPens with her, you know. And then on the way, they had flown to Europe, and they were on their way back, and they had flown into the airport. And Gary, her husband, drove through Taco Bell. She took one bite of a burrito and had another reaction. So, you know, she shot herself with her EpiPen, and every time she tries, she keeps trying. I don't know why she keeps trying. I finally told her that if you do that anymore, I'm going to come and I'm going to intubate you with my fist. So anyway, so she had gone to, she lives in Knoxville, Tennessee, and she had gone to Nashville to some friends. It was football season, so it was just this past January. And doesn't that seem like so far away, because we've been cooped up for so long? But anyway, she had eaten, she ate a chicken taco. She made sure it was chicken, but the meat had gotten contaminated. It was near the beef, or maybe mixed with the beef, or something that nobody knew about. And she again had to go to the emergency room. So let's see, I can find the name of this here. It's, you know, my phone doesn't work. It's the Lone Star tick, that's what it is. And you can, the specific allergy is related to a carbohydrate called alpha-gal, and it's best diagnosed in a blood test. So, you know, those ticks, there's a lot of them out there, and we get bit a lot and we don't think too much of it, but there is a possibility for it to be a real problem. So, you know, if you get bit, especially if you develop what we call a bullseye, and it looks just like a bullseye. The center of it is where the tick bit you, and then around it is a reddened circle. And that's indicative of Lyme disease. So if you see that, you get to your doctor, and he can do a test, but he can also put you on some doxycycline to take care of that. So if you're bit by a tick, you remove the tick as promptly and carefully as possible. You can use a fine-tipped forceps or tweezer. Grasp the tick as close to your skin as possible. Gently pull it out, and with a slow, steady upward motion. You don't want to twist, you don't want to squeeze. Don't handle the tick with your bare hands. Experts do not recommend petroleum jelly, fingernail polish, or a hot match to remove a stick. And I've heard of all those, a tick. I've heard of all those things, and we've all done that or heard about it. So remove that. This particular information from Mayo Clinic says put the tick in a container and put the container in the freezer and bring it to your doctor if he wants to see it. I don't know one tick from another. I mean, I know some are itty bitty, teeny weeny, they call seed ticks, but I don't know what ones bite and what ones cause what. So it doesn't behoove you to bring it to me, but some other doctors are probably much more up on all this kind of stuff than me. And then, of course, be sure you wash your hands and wash the site where the insect bit you. If you develop a severe headache, difficulty breathing, paralysis, heart palpitations, feel like your heart's running away from you, you need to call 911 immediately. If you aren't able to completely remove the tick, you need to go somewhere, because the longer it's attached to you, the more chance of developing a disease. And if the rash gets bigger, it might start with a small red bump where the tick bit you. That's normal. But if it develops into a larger rash or with the bullseye pattern, it may indicate Lyme's disease, and then you go to the doctor. And I give plenty of people that medicine prophylactically, meaning we don't know if you've got it, and it takes several days to get the test back, and then if it's on the weekend, and I don't want to waste those days not treating somebody. So I treat them, and then if it comes back negative, I'll call them and tell them to not take the medicine anymore. Flu-like symptoms is a big problem with tick bites, and so if you have any fever, chills, fatigue, muscle, joint pain, a headache, if that all accompanies a rash, go to the doctor. If you think that the site is infected, because it can get infected. Anytime you break something in your skin, our skin is our first barrier, our first line of defense for our immune system. And if you make a cut in that or open it for any reason, it can get infected. And so you've got to make sure that it's not red or oozing. If that's the case, go to your doctor. It says if you think you're bitten by a deer tick, I guess that's the one that causes the Lyme, and you might need antibiotics. So I guess the best thing is to go. And hopefully it's nothing, and hopefully it's just going to be a wasted trip to the doctor. But I'm a firm believer in an ounce of prevention is worth a pound of cure. So if you feel like you've been bit, go to the doctor and get yourself something to take care of it. So we're going to move into spider bites, but it's just about time for our first break. So we're going to take our first break, and then we'll be back to talk about spider bites. Isn't that exciting? So don't go away. Hang in there with us, and we'll be back right after these messages from our sponsors. Don't go away.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Looking for an affordable option to treat erectile dysfunction? Ward's Specialty Pharmacy now has low-cost Tadalafil Troche. Compounded Tadalafil Troches are small lozenges that dissolve between your gum and cheek. Many ED treatments can cost hundreds of dollars. Take advantage of Ward's Specialty Pharmacy's competitive pricing. 10 doses of Tadalafil Troches are only $80. A prescription from your doctor is required. Call Ward's Specialty Pharmacy today, 252-459-5544.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hello, I'm Gus Tullis of Gus Tullis Insurance. A bill stretching your retirement income too thin? Let me help you find a way to pay off your debt and provide you with peace of mind. If you're 65 years or older, you can possibly sell your life insurance policy through a life settlement program at 3 to 5 times more than the cash value. If you're a senior, don't struggle to pay those premiums or let your policy lapse. Call me today to see if this makes sense for you.
I did have a sharp stomach pain. It was pretty bad. I called my husband. He drove me to the emergency room at Nash UNC. I had perforated my colon and they wanted to do emergency surgery. The staff at Nash UNC were wonderful. Anything I needed, anytime I felt scared, there was always somebody to comfort me. And that's important when you're going through something you don't understand. They were all wonderful to us and helped us through that journey.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hello, welcome back. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical. And tonight we've been talking about ticks. Now we're going to move into spider bites. These are all things that happen to us through the summer. We're outside more, you know. I live out in the country. I've got a lot of woods. I like to tramp through the woods and look at I've got some beautiful ferns in those woods. I'd love to dig them up and plant them someplace else, but I don't think they'd make it, so I leave them be. Anyway, so we'll move into spider bites. And spider bites, like tick bites, most of them are harmless. Many bites attributed to spiders have turned out to be inflicted by other bugs. And skin infections have also been mistaken for spider bites. I think spiders probably have a pretty bad rap for their bites. Only a few types of spiders have fangs long enough to penetrate human skin and venom strong enough to hurt a human. In the United States, these include the black widow spider and the brown recluse spider. Spider bites can cause redness, pain, swelling, or you may not notice them at all. Black widow spider bites can cause severe abdominal pain and cramping. Brown recluse spider bites may cause a sting or a sharp pain like a bee sting. With severe bites surrounding the skin, they die within a few hours. That's called necrosis. The skin dies. Both types of spiders generally live in undisturbed areas such as attics or sheds, and they don't normally, threaten you unless they feel threatened. Typically, a spider bite looks like any other kind of a bug bite: red, inflamed, itchy, painful bump on your skin, or it may go unnoticed. Harmless spider bites usually don't produce any other symptoms. Signs and symptoms of a black widow, and we do have those around here. Spider bite may include pain, swelling. You'll have pain around the bite, which can spread into your belly, back, or chest. Cramping, you might have severe stomach cramps, which are sometimes mistaken for appendicitis or a ruptured appendix. So, boy, that would be bad to have your appendix out and find out it wasn't your appendix, it was a spider bite. You may experience some chills or sweating with the spider bite. The pain associated with the brown recluse spider bite typically increases during the first 8 hours after the bite. You may have some chills, fever, body aches. The bites normally heal on their own in about a week. Sometimes the skin at the center of the bite turns dark purple or dark blue, and then it can form an open sore, which is called an ulcer, that gets bigger as the skin around it dies. Ulcer usually stops growing within 10 days after the bite, but it can take months for full healing. So, we live in such a microwave society. We want everything right now. And, God made our bodies to be slow cookers. Our bodies will heal themselves, but it takes time, a bad sprain can take 4 to 6 months to really heal. So don't think that you can run to the doctor and he or she can give you something to make it better sooner. It doesn't work that way. And we can give you something for pain, of course, make you more comfortable, but your body's got to heal itself. So when do you go see a doctor if you've had a spider bite or any kind of bite that you're worried about? If you're unsure if it's a poisonous spider, if you were bitten and experienced severe pain, abdominal cramping, or growing ulcer at the bug site. And you have to be careful for those ulcers because they can turn into cellulitis, which is an infection in your skin. Or if they've been bitten and they're having breathing problems, then you really need to get them to the ER quick. And your doc's probably going to want to give you a tetanus shot. Most of us, we haven't had shots since we were in school, and so most all of us need a good tetanus shot every once in a while. Severe spider bite symptoms occur as a result of the venom that the spider injects. How severe the symptoms depends upon the spider that bites you and the amount of venom that was injected and how sensitive your body is to the venom. Every body is different. So how I respond to a brown recluse spider bite may be totally different than what you respond to. Risk factors for spider bites, of course, is living in areas where the spiders live. I don't know I know we have brown recluse and black widows here, but I don't know how prevalent they are. I'll try to look that up at the break. black widow spiders and brown recluse spiders like warm climates and dark, dry places. And risk factors, are living in these areas or by disturbing the spider's natural habitat. You're walking through the woods or you're walking and you disturb something you didn't even know it was there. Black widow spiders can be found throughout the U.S. except Alaska and the far north. They live in sheds, garages, unused pots and gardening equipment, wood piles, closets and cupboards during the cold weather. I don't like to think of a spider being in my house, but all in all, I like spiders because they provide a web and they catch flies, and I really hate a fly. They're just nasty, dirty, irritating. So I don't, if I've got a spider web someplace, I let it sit. I don't mind that outside. All right, the brown recluse habitat is more in the southern Midwest and in limited areas of the South. Recluses are so named because they like to hide away in undisturbed areas. They prefer to live indoors, such as the clutter of basement or attics, behind bookshelves and dressers, and in used cupboards. That's what they like inside. Outside, they like dark, quiet spots such as under rocks or in tree stumps. And both a bite from a black widow or a brown recluse, they can be deadly, especially in children, because they're young, they're small, their immune systems are not as strong as ours, and they're a smaller body, less habitat, so it's easier for them to get sicker than us. Spiders in general bite only in defense when being trapped between your skin and another object. So to prevent spider bites, learn where they live, what their preferred habitat is. Wear long sleeve shirts, hat, long pants tucked into socks, gloves, boots when handling stored boxes or firewood, or when cleaning out sheds, garages, basements, attics, and crawl spaces. Well, I'm hot-natured, and I am not going to go outside and work in the yard and have boots and my pants tucked into my boots and long sleeve shirts. It's just not going to happen. Inspect and shake out gardening gloves, boots, and clothing before use. Now this says use insect repellent such as DEET. I cannot promote that. That is a poison. It can get into us through our skin. It is not healthy for us. I love essential oils, and I use essential oils, and there are essential oils that you can spray that is a natural deterrent to spiders and mosquitoes and all sorts of bugs. So I cannot promote DEET. Keep insects and spiders out of the house by installing tight-fitting screens on windows and doors, sealing cracks where the spiders come in, and using safe indoor insecticides. Again, I use essential oils, and you can get a couple drops of essential oil into a glass spray bottle, spray all over. Most bugs hate peppermint, and they're great for ants, and peppermint is a great deterrent for ants. So if you got ants, get you some peppermint essential oil, put it in a glass container or a PET container that's a heavy plastic, because the oils will leach into regular plastic and they would burn a hole through this styrofoam cup. So you've got to watch what you put it in, or you're going to lose it, because it's going to, in a regular plastic one, like the plastic spray bottles you get at the dollar store, it'll leach right into that plastic. All right, so don't keep rocks and lumber around your house. Avoid storing firewood against the house. It says don't push your beds against the wall, and only let the legs of the bed touch the floor. I don't know. I wouldn't have that anyway. But anyway, Vacuum spiders and spider webs and dispose of them in a sealed bag outside to prevent re-entry into your house. If a spider is on your skin, just flick it off rather than crushing it against the skin. And when cleaning tarantula enclosures, now who's got a tarantula enclosure hanging around? I guess maybe you work at the Children's Museum? Anywhere. Wear gloves, surgical mask, and eye protection if you're going to work with those tarantulas. And I kind of don't think anybody that I'm talking to is going to listen or is going to be working with tarantulas. But just in case, now you have all the info that you need. So, you know, and the other thing, some of the things that you see more in the summer are lacerations and cuts, like from lawnmowers, and you're outside digging in your garden and you get scratched on something. So again, your doctor's probably going to give you a tetanus shot or something like that, because we've got to take every protection that we can get. So I'm just gonna I'm gonna save the heat-related illness and symptoms for the next break, which is going to happen in a minute. So I'm going to be having a lady from the hospital coming on, and she's been very innovative over at the hospital and showing how to make COVID places, you know, so that they won't be in the main hospital, the main medical part, and she'll be talking about the safety of it. And there's still COVID patients over there, and there's still I haven't seen any COVID, but it's still out there. So I don't know for sure what the masks, they say don't wear them, they say do wear them. I don't know. I don't wear one because I've got a pretty high immune system. I've worked in medicine for over 30 years, and in the ER I was exposed to a lot of things, like even anthrax. I was exposed to anthrax. So I'm just blessed because I don't worry about that stuff too much. My daughter thinks I'm a fool for not worrying about it. My oldest son is like, you're not going to get sick, Mom. He and I think alike. And my baby boy, he lives in Asheville, so I did say one time, I'd really like to come up and see you. He said, Mom, you can't come see me. You might have the COVID. So anyway, we're going to take our next break. And when we get back, we're going to talk about heat-related illnesses, symptoms, what's a heat stroke, what's a, those kind of things. So we're going to talk about that. So we're going to go, and I'll see you back in just a few minutes with more of Here's to Your Good Health. Don't go away.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Hello, I'm Gus Tullis of Gus Tullis Insurance. A bill stretching your retirement income too thin? Let me help you find a way to pay off your debt and provide you with peace of mind. If you're 65 years or older, you can possibly sell your life insurance policy through a life settlement program at 3 to 5 times more than the cash value. If you're a senior, don't struggle to pay those premiums or let your policy lapse. Call me today to see if this makes sense for you.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
I was playing flag football with a bunch of childhood friends and reliving the glory days, and I felt the pop. I wound up tearing my quadriceps tendon. The MRI took place, and then it was like you really need surgery. Surgical repair is the only way to fix it. After surgery, of course, there was the rehab phase, and it was a breeze. It really was worth it. To do it here with a qualified and exceptional team, this was the best place that I could have chosen, and it's right here in Rocky Mount. I was treated like a rock star.
Are you suffering from chronic pain, have aches, migraines, or just general discomfort? Ask Ward Specialty Pharmacy about their new pharmaceutical-grade, full-spectrum hemp extract, commonly called CBD. CBD has no known side effects and is available without a prescription. CBD can potentially help with migraines, anxiety, depression, insomnia, and other discomforts. Ask the knowledgeable staff at Ward Specialty Pharmacy about CBD and start feeling like yourself again. Ward Specialty Pharmacy, 3646 Sunset Avenue, Suite 110 in Rocky Mount.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, welcome back. This is Here's Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical, and we've been talking about some of the illnesses and the problems that happen at this time of year here and other places of course as well. But you know, summer we're out more, the bugs are out, everything's out. So we talked about tick bites and spider bites. So I just want to touch a little on heat stroke and heat exhaustion, which both are very, very serious. If you stay out in the sun too long, my husband, he's hard-headed, and he'll come in and he's just drenched, and he can hardly pick one foot above in front of the other because he's been outside and he's just been drained from the heat. But heat cramp symptoms include severe and sometimes disabling cramps that typically begin suddenly in the hands, calves, or feet. Hard, tense muscles. Heat exhaustion symptoms include fatigue, nausea, headache, excessive thirst, muscle aches and cramps, weakness, confusion or anxiety, Drenching sweats often accompanied by cold, clammy skin or a sensation of prickly skin. Slowed or weakened heartbeat, dizziness, fainting, agitation. Heat exhaustion requires immediate attention. And if you're my husband, you're going to come in the house, you're going to drink 2 bottles of water, and you're going to sit until you cool off. He would never let me take him somewhere. And most of the time that does work for him. So, you know, I'm not saying you have to run to the emergency room, but you really need to get somebody cool. You know, I've even seen like out people running and they sit under a shade tree because they got too hot. You know, we can't mess around with our bodies like that. We have to do what we got to do to take care of ourselves. Heat exhaustion requires immediate attention, like I said. Heat stroke symptoms are very similar. Nausea, vomiting, headache, dizziness, vertigo, fatigue, hot, flushed, dry skin, rapid heartbeat, dry skin, excuse me, profound sweating, shortness of breath, decreased urination, blood in urine or stool, increased body temperature of 104 to 106. And let me tell you, I've seen some people with 105 temp, and they are just like, I mean, they're just totally lethargic. And in the ER, we used to get ice bags and pack them up here under their arms because that would help get it, you know, the cool all through the whole body. Where was I? Oh, increased body temperature, confusion, delirium, loss of consciousness, convulsions. So you see, this is really serious. You just don't play around with this kind of stuff. And you know, it's getting really hot out, and it's really muggy now, starting to get really muggy. So you can't go and sit out and pull weeds or lay in the sun or do all the things that I love to do at 2 in the afternoon. You know, you got to go at 8, 9 in the morning or 7 o'clock at night when it's cooler and you can get those things done. I don't like going at night. First of all, I'm always tired after work, and I don't do much. You know, by the time I get something to eat and clean up the kitchen and clean the cat box, I'm about done. I can tell you, I'm about done. I don't have too much energy after a long day at work. But now I lost my train of thought. I'm so sorry. Heat stroke can occur suddenly without any symptoms of heat exhaustion, and if that happens, if you're fine, all of a sudden you go boom and you fall down, you get really sick, call 911 then. It's got to be done immediately because any delay could be fatal. And one thing that I haven't seen since I worked at the hospital in the ER, but and we do see that here, is tobacco sickness. And that's when people are out in the tobacco fields, you know, cutting off the flowers and all that, pulling off the dead leaves. I don't know what all that's called because I'm not from here, so I'm not up on all the tobacco terms. But a lot of Hispanics, you know, they work out in those fields, and unless you wear long sleeve shirts and that, because if the green leaf of the tobacco is wet, there's dew on it or something like that, that gets into your skin, and it's like inhaling the cigarette, but it's green tobacco, and it can make you really sick. You get nauseated, vomiting, and that kind of thing. So that's pretty dangerous too. Not that a whole lot of you out there are working in tobacco fields, but there might be somebody, or you might have a tobacco farm and you hire people. I don't know. All right, we're going to top off our night with snake bites. That's not my favorite topic. I am deathly afraid of snakes. If I see a snake, people say, you wouldn't kill it? Oh no, I'd be halfway to Rocky Mount before they could stop me from running. Most snakes are not dangerous to humans as far as biting or attacking. They're dangerous to me because I feel like my heart stops every time I see one. I'm so afraid of them. And I know that's probably silly, but it is what it is. So that's just me. And I'm not alone in that boat, I can tell you that. I know lots of people that are scared to death of snakes. Only about 15% worldwide and 20% in the U.S. are venomous. In North America, these include the rattlesnake, coral snake, water moccasin, and copperhead. I don't know that I've ever seen a coral snake, other than maybe in a, what do you call it, a zoo or something like that. But I have seen rattlesnakes. I have walked, excuse me, near rattlesnakes. We used to live in Southern California. Excuse me a minute, I'm sorry. And we had gone walking on a creek bed, and we were picnicking. I didn't have my third child yet. It was my older two. And we had carried a basket, and we were, walking, splashing in the water and walking down the path, and we packed some drinks and some sandwiches and that kind of thing. And my husband and my daughter, and I guess Sarah was probably 5 or 6, 5, maybe 4, little. They walked ahead of us. And then my oldest son, Lewis, and I were behind, and all of a sudden I heard the rattle. And there in the path, how it got there between where my husband and my daughter were and where my son and I were, I don't know, but it scared the pudding out of me. I stopped dead. Of course, I had to protect my son. That's probably the only reason I didn't have a heart attack. And so my husband, I screamed and hollered, and Bob turned around, "What's the matter?" I told him, and he said, "Now hold it, hold it." And so we had to wait. We probably waited 20, 30 minutes, I don't know, till the daggone snake moved, because I was afraid to go around it. I was convinced that it was going to strike at me or strike more. I was more worried about it striking at my son. So, you're supposed to move beyond the snake's striking distance. Well, I don't know that stuff. And when you're scared to death and you're protecting a 6-year-old kid, who knows about striking distance? It says remain still and calm. Well, that ain't gonna happen with me either. But if you do get bit by a venomous snake, call 911 immediately. Especially if the bitten area changes color, begins to swell, or is painful. Many emergency rooms stock anti-venom drugs which may help you. And I don't know if they've improved those drugs since I was in the ER, but some of the side effects of those drugs were as bad as the daggone bite itself. So, you move beyond those snakes' striking distance. Remain calm and help slow the spread of the venom. Remove tight jewelry and clothing before you start to swell. Like you'd have to take your wedding ring off, because that would, your hands could swell up. Position yourself if possible so that the bite is at or below the level of your heart. So, if you get bit in the leg, you can just lift up your legs. But clean the wound with soap and water and cover it with a clean, dry dressing. Don't use a tourniquet. We see that all the time. You put the tourniquet on in the movies, and then you cut and you suck out the blood. And, I guess that was just in cowboy movies years ago, but that's not what we do. No tourniquet, no ice. Do not cut the wound. Do not attempt to remove the venom. Do not drink caffeine or alcohol, which could speed your body's absorption of venom. Now, who's going to be sitting there drinking an alcoholic drink when you got bit by a snake? Well, maybe that wouldn't be such a bad idea now I think about it. No, kidding. Don't try capture the snake. Try to remember the color, the shape, and describe it, which will help you in your treatment. If you have a smartphone with you and it won't delay your getting help, take a picture of the snake, and that will help with the identification. And I'll tell you, when I was in the emergency room, this was years ago, and people would bring food, and they'd bring donuts, and they'd bring candy, and they'd bring all sorts of stuff that we could snack on and munch on and talk about, and people were always bringing something. So I was at the nurse's station, and there was a bucket there, and I thought, well, what's in here? And I brought it towards me and looked and jumped back and screamed bloody murder. Somebody had been bitten by a snake and brought the daggone snake and put it in a bucket, and it was up there on that. I thought I was going to die. And it was not a dead snake, it was alive. It was a little itty-bitty thing, but I don't care if it's itty-bitty or huge. I am just such a wuss when it comes to snake bites. Anyway, back to our snake bites. Snake bites occur mostly on the extremities, on your hands, feet, forearms, lower extremities. The typical symptoms of the bite from a non-venomous snake are pain and scratches at the site. Usually after a bite from a venomous snake, there is severe burning pain at the site within 15 to 30 minutes. This can progress to swelling and bruising at the wound and all the way up the arm or the leg. Other symptoms include nausea, labored breathing, and a general sense of weakness, as well as an odd taste in your mouth. Some snakes, such as coral snakes, have toxins that cause neurological symptoms such as skin tingling, difficulty speaking, and weakness. I've never seen a coral snake. Are they coral color? Is that what they call them then? I would guess that's it. That's a pretty color, I can tell you that. And a non-venomous snake can bite without injecting venom. And the results of these, what they call dry bites, is irritation at the site, but there's no venom, so that's what you worry about is the venom. Most venomous snakes in North America have eyes like slits and are known as pit vipers. Their heads are triangular and they have fangs. One exception is the coral snake. Here we go with that little bugger again, which has a rounded head and round pupils. Non-venomous snakes typically have rounded heads, round pupils, and no fangs. So, again, I'm not going to look that close or that long to see about a round head, a pointed head, slits for eyes, because I'm telling you, it's a bad thing for me. All right, it's time to go. I will see you next week with more of Here's to Your Good Health. Don't miss us. We love having you, and we'll see you then. Have a great evening. Good night.